I want to welcome you to the Workplace Violence Training Level 1. My name is Vicki Sanders. I work for OSHA Consultation. And this is a partnership between OSHA Consultation, Department of Labor and Industry, and Minnesota Department of Health Adverse Events. And so I want you to know that this training is a basic training. Your own employer or hospital facility is going to provide you additional training as time goes on. But this is something to start with that should be applicable to all employees that work within your healthcare facility. The name of this presentation is called Recognize, Respond, and Report. If you can remember those three things, you've done a whole lot towards de-escalating violence or aggression in your workplace. We want you to be able to recognize when things are happening. We want you to be able to respond appropriately, and we also want you to know where and when to report. We want to recognize potential violence situations before they happen. We want to prevent patient agitation or hostilities from escalating, and learn when to intervene and when to get help. We're also going to go over some minimum verbal de-escalation skills and techniques. So the number one rule is to do no harm. And what does do no harm mean? Ultimately, it means to give thoughtful consideration to our actions. Do no harm simply means to consider how our actions may affect the world we share and to be compassionate in our dealings with everyone. And we also want you to expect the same mutual respect to you as you do your job. Creating a peaceful environment is a team effort. We've learned from Katrina that nothing is done by itself. We learned that it's a team effort, whether you're a neighborhood and you're having a block club and you care about your neighbors or what's happening at their house or their household and you report it. It means that when something happens in your hospital or healthcare facility, it's part of your responsibility to care about it. It's not the administration, it's not just security, it's not HR, it is your place of business also. You have a duty to warn. If you see something that's happening, say something. Say something to a security, say something to another employee, but let people know that there might be something brewing and that there might be a problem that could happen intimately or soon. A duty to act. Now, we're not asking you to be Hercules, Superwoman, Superman, or any of those things. All we want you to do is a simple, how are you doing? Can I get you a cup of coffee? Can I help you find your direction? It doesn't mean that you have to be a huge student of intervention. You simply have to care enough to intervene when you see someone's having a problem and give them some basic courtesies and help. When we talk about what is workplace violence, violence is not only just physical assaults. It includes an act in which a person is abused or intimidating. It talks about emotional and psychological health of a person. It includes slamming doors and screaming at somebody. It includes swearing or cursing or calling someone outside their names. Those all create physical or emotional or psychological violence. So a person doesn't have to be physically hit to be emotionally affected. So when we talk about violence, we're talking about the gamut. What it does to the workplace, what does it to that person, and what kind of atmosphere does it create in that environment or inside that person. And also any perceived act that causes fear or harm to an employee, a patient or resident, or a visitor in a healthcare facility. Now note that this definition is a little bit broader than the definition in the Violence Against Healthcare Workers law. But we want a definition that to start with to let you know that you have a right for a safe environment and you have a right for a place where you can feel comfortable. When we talk about intent to harm or lack of intent to harm should not affect the response of an act of violence against a healthcare worker. If I was to get hit or assaulted outside of a hospital, it would be considered a criminal act and people would address it immediately. I would get the care that's needed. But somehow when it comes to a hospital or healthcare, if it happens in an ER or a psychiatric unit, there's somehow that thought that the person was justified in their reaction because they were upset. They were justified because they were mentally ill. So there's sometimes we have to think about, is not the intent of a person. It's the fact that it did happen, and what can we do to prevent it from happening. It doesn't mean that we have to call the SWAT team every time there's an assaultive behavior, but it does mean that we are going to address it and document it and take it seriously. When I talk about universal behavior precautions, a lot of times people try to put a face on violence. What does violence look like? It's not a religion. It's not a color. It's not a nationality. It's not a person who comes from a different culture or background from you. It's actually, if you want to put a face on it and you look to your left or right of the people in the room, it's us. There is no physical characteristics of who is going to create violence. What you look for is behavior. There's the potential for patients or visitors to become verbally or, in rare cases, even physically assaulted when they're in crisis situations, when they're upset, when there's a death of a loved one, when they don't know how to handle crisis and it's beyond their capabilities. It can happen to anybody at any time. And so what we want is for you to be able to recognize it early and have sufficient enough skills that you can intervene. And I might say, don't intervene. Because if you're going to make it worse, or if you don't have the skills necessary to intervene, then it's best for you to tell someone or to get additional help than for you to interfere and escalate the situation. And now these tips are designed to help you recognize escalating behavior and take appropriate precautions. First thing we want you to do is calm yourself down. Relax. It's a frightful situation to try to intervene when someone's out of control. And sometimes you may not even want to intervene. If you calm yourself down, just like if you're on an airplane and the oxygen mask comes down, they tell you to put the oxygen mask on before you put it on a child or a distressed individual. If you're upset, it's going to escalate the situation. So you got to put your game face on. Make sure that you're relaxed, calm yourself down, and begin to look at your situation to see how you can intervene safely. Remember, you want to respond, not react to the situation. So take a deep breath, appear calm, centered, and self-assured, even though you don't feel like it. Fake it until you make it. Use a modulated and low monotonous tone of voice in order for you to calm the person down, because they're going to mirror your behavior. If you're excited, they're going to react. It's almost like road rage. One person gets upset, another person reacts, and it will keep going till it escalates. If you remain calm, no matter what the situation is, the person might emulate you. And if you've got a low tone of voice, they would have to lower their voice to be able to hear you. So do not be self-defensive. Even if the comments or insults are directed towards you, it's not about you. This person's in crisis. You know who you are. So if they call you names or say things, that you're not who they represent. Take the professional stance. Your goal in this whole interaction is to bring the person from this height to down here. Be aware of any resources available to back yourself up. Is there people around? Is there security? Is there someone that they can just go get help? Do you have communication that, a phone or a cell phone or a panic button that you can push? Be firm, but be respectful when setting limits or calling for help. Do not be threatening or to get into a power struggle. Remember that you're the professional. You're representing yourself and your organization. If a person's going to have a bad experience at your facility, they're going to remember the whole facility. They're not going to remember the fact that it was the maintenance man who was rude or the dietitian that was very curt. They're going to remember that when they went to Brown Hospital, that the staff there was bad. If they have a good experience, it could be from the person who greets them at the front desk to the person who brings them their food. Everybody has a part and a role in a person feeling comfortable and for de-escalating a situation. So when we look at our first tip, recognize, be aware of your surroundings and your environment. Who's around that person? Are they aggravating the situation? Are they intimidating and causing more problems? Make sure that there's only one voice that's speaking to the person at one time. When there's multi-voices, even if it's a coworker, it gets confusing. So look and see who can help. Sometimes family members can help de-escalate, but in most times they agitate the situation. What physical objects are in the room? Are there something that could be a weapon? Is it furniture? Is it tools? Is it something that could cause a problem to someone who's in a crisis situation? And look at the physical space. There's two things you want to look at. One, where's the exit? Anybody who's in a profession, especially security, and myself as safety, I always look and see where is the exits. How do I get out if things get dicey? The second thing you want to look at is, are you blocking that person from getting out? Are they feel trapped or closed in? Both ways, if possible, you want to try to avoid. If a person's feeling closed in or trapped, they might want to fight their way out to get into an open space. Survey your environment. Stay near the exit if possible. Try not to block the exit or trap the patient in a room where you're between them and a way to get out. Do not turn your back on the client if possible, and arrange the setting so that your client is not between you and the door to the room. Know the safety protocols and the emergency exits for your unit. Work in teams, not alone, if there is a chance of impending violence. Be aware that other people can help or hinder the de-escalation process. That's family, friends, onlookers, and co-workers. Survey the environment for weapons or potential weapons. Can a pen be a weapon? Yes. Can a mug be a weapon? Yes. Can any of your instruments, such as a needle or a knife? Yes, they can all be weapons. But even something like a lanyard around your neck could be used as a choking device. So when you go to intervene and there's potential for violence, try to eliminate as many hazards as possible when you go into that environment. To respond, what we want to talk about is verbal de-escalation. Now, there's different methods, different processes that you can use to de-escalate a potentially violent or aggressive situation. But verbal de-escalation is a technique used during potentially dangerous or threatening situations in an attempt to prevent a person from causing harm to themselves or to other people. The use of physical force is never recommended. Now, physical force would only be used as a last resort to prevent injury to yourself or to another person. So the key for this one, the least amount of force necessary to prevent the harm. Use of physical force usually results in someone getting hurt. You want to make sure that that's not you. Now, personal anger escalation. Usually a person goes from calm to agitated to verbal hostility, and they do it in steps, sequential steps. But sometimes those steps skip, and sometimes they go very quickly, so they can go from calm to critical events very, very fast. The best time to intervene and to cause someone to return back to a calm state is in the very early stages. So if you can intervene when the person's agitated, can't find the room, can't find the doctor, someone hasn't gotten back to them, it's easy to bring them down to a calm step. Once they get into verbal threatening or physical threatening, or even the critical event, then it's very, very hard to use verbal de-escalation to calm that person down. So that's why it's important that if you recognize it early and you intervene early with non-invasive, non-physical intervention, you have a better chance of calming that person down and restoring order. Some things that hinder effective communication, background noise, are you having to yell or speak loudly? Language barriers in which there's communication gap. Perceptions and prejudice either on either part of either the receptive, the hearer, or the person who's giving the messaging. Intrusion of personal space, and that's a big one, especially in hospitals, because in personal space, it seems like it's eliminated once in hospital because you have many, many different professionals coming in and out of a person's room, and that space is eliminated sometimes during a hospital stay. Time constraints, are they things being rushed, or are people waiting excessively long periods of time? Or is there just lack of encouragement? A person's waiting, they're not hearing, a person's in surgery, they don't know if the person has made it or not, they don't know if the person has even passed away because nobody's getting back to them. And the longer that they wait without information, the more anxiety happens while they're waiting. So things that can trigger agitation: one, psychiatric illness. Sometimes substance abuse can can alter their thinking or their emotional state, reactions to medicines. There might be criminal issues. Perhaps they're worried that the police will come because they've been shot, or the police might come because they might have to answer questions of what happened to their injuries. There's highly stressful situation where a relative or loved one is sick. You don't know the outcome. There's domestic abuse that might be happening or still happening while they're at the hospital. Death of a loved one. These are all things that could that could trigger someone to being agitated. Some other things that might trigger just the simple procedure. Sometimes the MRIs are just very frightening to someone who's claustrophobic. They might be afraid of the disease. The cancer word is very frightening to some people. The cost of treatment, because hospital stays can be thousands of dollars, and if you don't have it, it could be very, upsetting. There could be lack of response or information from staff. No one knows what's going on or know what's happening to the person that's being treated. And there could be even conflict between family members or friends or loved ones, especially for someone who's unconscious or comatose. There could be a fight on the treatment. There could be a fight on the lack of treatment or the disengagement of life-giving equipment. What are the things that triggers agitations? Feeling of powerlessness, of fear, grief. Sometimes there's root causes of things that happen. And if you can't always diagnose what's happening, but if you do know what the trigger is, it can help yourself or others come up with a solution. So other signs of agitation, if you hear raised voices, a high-pitched voice, because sometimes when we're upset, our vocal cords constrict, rapid speech, pacing back and forth, a person who's excessively sweating or fidgeting. Look at their body movements. Their hands are balled, because sometimes when people are upset, they close in on themselves and close their hands. Is there excessive hand gestures? Start watching how they're looking, how they're posturing themselves. Recognize early warning signs such as behavioral changes. If a person who's normally quiet or has been quiet all of a sudden starts getting loud or agitated, it's a sign that there might be impending violence. Increase agitation, decrease engagement with the staff, which means people sometimes just shut down. They stop answering questions, they stop looking at you, they stop responding, whereas they were talking before. It's a sign that there's a behavioral change. It's not necessary that it's going to turn into violence, but it's a sign or a warning sign that you should pay attention to. Commenting on those changes might open up some conversation and minimize frustration or angry. At least they see that you notice that they're upset, or they notice that there's a problem. And give the patient an opportunity to diffuse the situation themselves. Sometimes when people start talking, it allows them to calm down as they begin to express how they feel. Recognize that anger is a normal emotion. We don't always need to fix it or be afraid of it unless a person becomes a danger. Now, anger is not normal when primarily used to get one's way, to manipulate, to get attention, to escape a situation, or to gain control or bully a situation. When we talk about aspects of communication, almost 90% of our communication is nonverbal. It deals with eye contact, our posture, our gestures, and our facial expressions. That's what people pay attention to, not just the words that you say, but how you say it. They look at your body language. They look at your pitch and your pace and how fast you say something. And then they interpret it. And remember, a person who's angry is sometimes looking for a reason to trigger a reaction. Yeah. For instance, let's take a look at this picture. What is this person saying? When we look at her body language, when you first come up to a person, she doesn't look happy. She looks upset. She looks worried. Can you think of anything that you would say to her at this time to make her feel comfortable? Can you provide her for anything? Can you try to distract her or give her some coffee? Or can you give her some information that might make it a little bit better? So your body language, I want you to appear calm, self-assured, even if you don't feel like it. Remember, fake it till you make it. Maintain limited eye contact. That means don't stare at the person, don't follow them, don't look like they're criminals or gangsters, but keep aware of what's happening in that, environment. Maintain a neutral facial expression. Place your hands in front of your body in an open position. Don't cross them in front of them, so that it looks like you're closed off, or put your hands on your hips so that it looks like you're overly authoritative. Be at the same eye level as that person. Create a balance of friendliness with that person. Now, if it's a situation where the person is combative or physical, you don't want to get too close, and you don't want to be within the area where they can reach you, kick you, or hit you, But if it's in that early stages, that level 1, the beginning stage where they're just agitated, that might be a good position to be in to try to calm them down. I want you to look at these two people on this slide, and what they're representing is what you don't want to do. Face-to-face, challenging, non-breaking stare, the fierce expression. What we want is for you to be maybe at a 45-degree angle. When you stand, don't stand John Wayne style, Stand at a 45-degree angle, 1 foot forward, one slightly behind at a 45-degree angle. It gives you better balance and stability. Also, if someone should hit or kick you, you can raise your arm and block a kick, or block a hit and raise your foot to block a kick. So you want to protect your inner organs. You also want to make sure you stay far enough away that the person cannot grab you, hit you, or kick you if the violence seems like it's impending. So when we look at this slide, we see the one on the left is facing in a more aggressive position. They're standing face to face, eye to eye, and it is more aggressive. It's more confrontational position. The ultimate or better position would be the one on the right-hand side, where they're standing at a 90-degree angle. There leaves an opening for either party to depart if necessary, and it's not as confrontational. You want to sit in this kind of situation because it opens it up, it doesn't block the person from a doorway, and it creates a better communication model. When we talk about personal space, we have 4 different spaces. One is an intimate space where you let your family, your friends, your loved ones in. That's usually between a foot and a foot and a half. Then you have your casual space, which is the space that you have for your close friends. Your social space is for your acquaintances, and your public space is for those that you don't have everyday interactive. When you go into a hospital, your public space immediately goes into your intimate space. And you got people coming into your rooms, you're probing, you're plotting, they're turning lights on, they're coming in. And it creates an atmosphere where a person just feels maybe even violated. If possible, if you're one of those professionals, start using things that could help create a sense of privacy, dignity, and respect for that person. Knocking on the door, may I come in? Are you okay? Try to use as much noise as possible. If you don't have to do a check at a certain time, let them sleep if they've been, sleepless for 4 to 5 hours within the, the elements of your job duties. So figure out what it is that you can create that sense of privacy, and beware of that personal space. Not everybody's used to someone coming at them 2, 3, and sometimes 4 people at a time, each doing procedures on their bodies, and it creates a sense of intimacy that they did not ask for, and most people don't want. Don't fence a person in. Violence-prone individuals perceive the need for a wider territorial space. When people are angry, they perceive that you're closer to them than what you are. They need 5 times the normal physical space than an average person does. So if you're used to a hula hoop size on an average basis, you need to widen that 5 times if a person's upset or angry. Otherwise, they have that feeling of being, again, closed in on. It's not just what you say, but how you say it. You can have a tone, and it could be stern or matronly, or it could be timid or wavering. Be fear and not very self-assured, so the person feels that you're not sure what you're doing. You could lower your voice. It might be uncertainty and it's how people perceive what you're saying. A raised voice could be anger or agitation. Watch your volume. Loud or overpowering could be someone who's trying to be authoritative or taking power control. Unwillingness to hear others. A soft or assuming voice might mean docility or a possible fear. The rate of your speech, is it slow but rhythmatic rate? which could be soothing, or is it too fast so that person's not hearing what you're saying? Are you using too many acronyms and words that are known to the hospital but not to an average person? Use politeness as something that's needed in our society. Use Mr., Mrs., please, thank you. Someone who's 80 or 90 years old might not necessarily be one known as Sally or Barbara. When they're in their own home, they're known as Mr. or Mrs. How you say something makes a big difference. Now, you take the sentence, you made it here on time. If you say it just like that, no one says anything. But if you add different things, like you made it here on time, in a suspicious tone, or you made it here on time, if you're irritable, it comes out in your messaging. So it's not what you say to a person. Think about the tone and how you're saying it to the person. Keep it professional and keep it non-personal. When we talk about rational detachment, it's the ability to keep in control of yourself and your behavior and not take acting out personally. Now, with this, I want you to know that we all have triggers, okay? There's some things that make us so upset or mad that we can't de-escalate. We just don't have the ability no more because we've lost it. Know what your triggers are. Know what it is that if someone says something to you that's going to upset you enough that you can't interact with that person, and tag off to someone who can. But before you get into the interaction, make sure that you're in good health, you're not overly stressed, that you haven't had 6 crises in a row, and now this is the 7th one, because you might not have the emotional stamina to deal with it. Sometimes you can use meditation or prayer. Training helps a lot. Practicing, if you're in a high crisis environment, practicing what you would say and how you would say things to different people help. During an interaction, make sure that you stay calm, that you breathe. Make sure that you're aware of your team that's around you. And sometimes you can create a team with not your normal co-workers, but maybe another co-worker that happens to be in the area but can aid or assist you. After it's all over, just don't go right back to work as usual. If you've been into any physical altercation or verbal altercation, debrief with somebody. Talk it over with somebody. Make sure you report it to your supervisor. It's okay to vent, but make sure you don't talk about the person but the event, because sometimes things can be overheard and misinterpreted. Modify your plan if something didn't work the first time. And if you have to leave work, if you've been into a crisis or having some post-traumatic stress, then do so, with the permission of your employer. So de-escalation is just as easy as just listening. And sometimes all it takes is to de-escalate someone is a good ear and time to allow the client to vent. Just listen to what they have to say and give them encouragement if needed. You don't have to solve their problem. You don't have to fix it. Just be an open ear for them to be able to talk. Some things that you can say to acknowledge it is, I understand that you are angry. I see that you're frustrated. You feel that you've been wrong. It's not saying that you're agreeing that the hospital is wrong or bad, or a certain doctor is didn't do their job. You don't want to side on that, but you do want to say that I understand why you might be angry, and that you're acknowledging and showing some empathy for that person. Some de-escalation is just allowing silence. Give the patient time to reflect. Don't try to fill in empty spaces with your words. Just listen and be there for them calmly. If necessary, if the situation was unjust or unfair, a sincere apology is powerful. Now, it doesn't mean that you're accepting blame. It does mean that you're acknowledging that something that occurred wasn't right or wasn't fair. Ask what we or the organization could do to make it better, and be very sincere about that. Don't tell them why it won't work if they give you a solution or a suggestion, or why that wasn't a good idea. Just listen and act and thank them for their input. Now, this may intensify someone's anger for a moment, but if you encourage them to continue and let them be heard, the conversation tends to end on a more positive note. Never threaten. Once you have threatened or given an ultimatum, all negotiations cease. It's over. because you put yourself in a power position and you're using a power play to get the person to comply. In this situation, you'll either be in a win or a lose situation. With verbal de-escalation, we're looking for a win-win situation. So try to keep your options as open as possible. Now, I'm not saying that not to set limits or to have consequences, but make sure that those consequences are within your ability to do, and make sure that you have tried other alternatives before you get to that point. And if you do set limits, make sure that you follow through. Do you have a plan if you can't de-escalate a client? What if you tried everything that you could, and no matter what you do, it's still escalating? What is your plan? What is the facility's plan? What is your organization's protocol, and what are the organization policies around staff safety? You need to know these ahead of time. As a homework assignment after this training, look at the policies within your facilities and get familiar with them, and definitely know what the emergency protocol is. Do you have a way of summoning others for help? If it's a panic button and you can't get to the panic button, what are you going to do? So find out ahead of time, before anything does happen, what is your protocol and what is your personal plan to do if you run into this situation. Report workplace verbal or physical threats to supervisors or managers, and warn others in the area if you feel that there's impending violence happening. Document the incidents on an incident report or follow your organization's reporting policy. So the 3 things we want you to remember is to recognize when impending violence might be happening, to respond in an appropriate way that keeps yourself safe and your clients safe, and to report any type of incident that might be happening. Thank you for being with us today.